Chance of death due to gunshots or stabbings exceed the risk of death from cancer or HIV and AIDS in the Bahamas for Bahamian men. Minister of Health Dr. the Honorable Dwayne Sands, sharing statistics from the Princess Margaret Hospital's Accident and Emergency Department, says the country is one of the leaders in penetrating trauma due to gunshots and stabbings. Cleopatra Murphy has more.
The Bahamas has the 11th highest homicide rate in the world, with bullets being the #1 cause of death for Bahamian males over the last few years. Minister of Health Dr. the Honorable Dwayne Sands cited a new crime study in the House of Assembly Wednesday that indicates 78% of murder victims between 2010 and 2015 died due to gunshot wounds.
We are one of the most violent countries in the world. We beat, stab, shoot, and rape each other at an unacceptable rate. Our homicide rate was triple the rate considered by the World Health Organization as an epidemic. I have said this repeatedly. It is in large part due to the professionalism of our healthcare team that our murder rate is not dramatically higher.
He says between 2012 and 2016, the Accident and Emergency Department at the Princess Margaret Hospital managed nearly 8,000 cases of assault, 7,935 to be exact. The department additionally saw 1,229 stabbing cases and 1,078 gunshot wounds. The minister says in 2016 alone, there were 1,272 assaults, 246 stabbings, and 216 gunshot wounds recorded, and the numbers do not include figures for doctors and the Rand Memorial Hospitals.
Although these statistics may seem as if the numbers are going down, the problem, Mr. Speaker, is that this is only people that arrive in our emergency room alive. You see, while our staff is competent, we can only help those that are brought in alive.
The minister mentioned the figures in the context of the growing cost of healthcare in the country due to violence, cancer, HIV/AIDS, and non-communicable diseases such as diabetes. Health received the lion's share of the 2017-2018 budget.
This year, the people of the Bahamas will entrust the sum of $307,596,885 of their tax money to the public health sector. That will be divided between the Public Hospital Authority, the Ministry of Health, and we have set aside $40 million to fund the program known as National Health Insurance.
Sands says the country's health expenditure ranks in the top 5 in Latin America and the Caribbean, and as a percentage of GDP has continued to grow for the past 20 years. He says the challenges presented by violence, non-communicable diseases, and other infections have the potential to cripple the Bahamas' struggling economy. Sands says fundamental changes must be made to modify behaviors and help prevent sickness. Cleopatra Murphy, ZNS Network News.